Dylan, I would like to ask you, not to switch topics here, but to switch topics here, I would like to ask you about what your thoughts are on all the medical stuff that we were talking about. Did you actually have a conversation with your dad, or?
No, I've talked with him about it a bunch of times. But just for the audience, I don't know how we got onto the topic, but basically we were talking about um, whether we think like doctors as a whole push pills or if they actually have like good insights and try to get people to have lifestyle changes, basically. Is that what you're talking
Hmm.
about?
Yeah.
I think it's a good mix of both. But so here's my question is why not why do you think what you think about doctors, but why do you think they push pills?
Well, I base more things in my life based off of like if I have a personal experience, I'm always going to lean into that more so than I would lean into what I hear from other people. And sometimes if I lean into my own personal experience and then I come to find out from various, grandparents or mother-in-laws or wife or friends or whatever that kind of go through the same type of experiences, I will start to lean into, oh, this is bad. This is a thing. And like I said, like Florida got so bad with opiates, man, like with Oxycontin specifically, that like you could just we used to just drive down there as youngins, bro, like 17, 18 years old. We would just ride down there and we would get a prescription, just like, ow, my back hurts. Okay, here you go. Here's some Oxycontin 40 milligram. I've never gotten prescribed an 80 milligram, but here's an Oxycontin 40 milligram. And then you would just go next door and you would get it filled and they write you a prescription for 60 of them things, bro. You just take them back. And like, that was beginning stages of
But
my addiction.
why do you think they do that?
Why do I think Florida did in that specific scenario? There's a documentary out about this that came out years later. At that point in time, I would have told you that, you know, I don't know what I would have told you at that time. At that time I just felt fortunate that I had, that I was scoring.
Free
But
drugs?
yeah, but whenever I watched that documentary, there was a doctor. Are you familiar with this documentary, Silver,
Uh,
with Michael
I've seen it.
Keaton?
Yeah,
What's the name
yeah, I've
of
seen
it?
it.
Do
I
you remember?
remember.
All right.
Hmm.
Well, in this documentary, Michael Keaton is a doctor. He plays a doctor. He's a good hometown doctor who would try to, he would try to prescribe you like ways to help, like extra careful about how much prescriptions he was giving out. And there were these reps for of the pharmaceutical company. I can't remember the name of the pharmaceutical company. Anyway, they had created this
Purdue.
miracle drug. Okay, they created this miracle drug called OxyContin, and it was they said that it was
Oh, Dope Sick.
non-addictive.
I think it's Dope
Yeah,
Sick is his
dope
name.
sick. That's it. And it was prescribed to people as to the doctors as this is non-addictive and it cures all pain. Why wouldn't you just? I mean, all pain. So why wouldn't you just prescribe this to your patients? And over the entirety of the country, especially in Florida, in those pain clinics, over the entirety of the country, man, it was like a flagship, and it waved all across our country. And all of a sudden, all these people were addicted to opiates because they were told this isn't addictive. And in the documentary, the Dope Sick documentary, Michael Keaton, who plays the doctor, well, I don't know if it's right to call it a documentary, but it was like a documentary slash film, I guess. They like made a movie out of the story. So
It's a
Michael Keaton,
docudrama.
and yeah, Michael Keaton ends up getting uh he prescribes the pills to himself and ends up getting dope sick himself, and then he like hates this company that did it, and it was all basically wrapped up in money. So on top of, just prescribing to the people, you're going to get 5% or 10% back of every prescription that they get filled, and that goes back into your wallet, goes back into your practice. And then we come to find out later that that's the way a lot of prescriptions work. If they prescribe you the drug, then they do get a kickback off of a lot of these prescriptions that they give. So it leaves you to wonder, like, especially with me at that time, like my back didn't even really hurt. I just lied about it and you gave it to me. Later on, I had a doctor in Savannah that did the same thing because after they kind of canceled out the Florida stuff, I just went to a doctor, found a doctor here in Savannah, first doctor I ever tried and first attempt ever. I was like, hey, I have attention deficit disorder and my back hurts. That's basically all I said. And it was like from that point forward, as long as I came to see him once a month, he would write me a prescription, not of not of that caliber, but oxycodone 10s, and he would write me a prescription for Adderall 30 milligrams 3 times a day.
That's my story too. But
And
that's aside from that, it doesn't even just it's not even just big pharma. It's also with surgeries. It's also with and especially whenever the general practitioner is tied in with like Methodist Hospital or like a bigger hospital, they push everything based on profit. So like they're not gonna talk to you about beetroot, right? You can take
mhm,
high dose beetroot and lower your blood pressure. They're not going to talk about that because they don't make any money on it. There's no kickback to the hospital. The hospital's not pushing it. I mean, same thing with surgeries and vaginal mesh and all. There's a documentary about that called I think it's Under the Knife on Netflix about this. The same thing that happened to my wife with a botched birth control program that was literally illegal in every single country in the world except for ours, and it gave her autoimmune disease. Like I've had
mm,
just a nightmarish experience with doctors. It's not just me; it's all my close friends. Like it's just
yeah.
I despise the system that we are
Well,
under. It
even my
is
grandpa,
horrific.
right? My grandpa in his 70s, I was with him when he like went here, and this was just, a couple of years ago. He went to have like a shoulder replacement surgery, and he's just firmly against any mind altering, mood altering substance, period. His dad died from alcoholism, and he choked on his own throw up. It was humiliating. His dad stole like all this money he saved up all summer for him and his brother to go on this little Christian camp trip that they were supposed to go on when they were kids. And like like he just hates it. Like he hates anything like it. And like so when he got this shoulder surgery, he was like, I don't care how bad it hurts. I don't want to take any kind of pain medication. And the doctors, even in that situation, were like, they didn't try to say, like, well, we can do ibuprofen or we can do tramadol or some of the non mood altering substance painkillers. It was just like, nope, you have to have this. We are writing you a prescription for it. It's up to you if you want to fill it or not, but we don't feel right sending you out of here without it. Which a lot of people would
Yeah.
hear that and say, well, they're trying to look out for you. And I told my grandpa this. I was like, listen, like, if you're in enough pain and you're not an addict, take the pain medication, bro. Because he's 70
Yeah.
some years old. I mean, how much can he do? But after seeing what I've seen in my life and going through what I went through with me, I was also there was a voice in the back of my head that was like, "That's pushing it on him, bro," and he didn't want it. You know what I mean? And
How's it pushing it on him though? Because uh, if you're a doctor, right? This guy says, "Oh, I don't want the medicine," and I say, "Okay, well, I'm going to write you the prescription anyways because you're going to be in pain. If you
yeah.
want it, grab it." Like, I don't know. How is that pushing it?
Well, it wasn't just and this is the worst example because I'm just trying to shed some light on a more recent experience, but the better examples to go off of is like all the stuff we were talking about leading up to this, but with my grandpa, it was more than just like, "Oh, I'm just going to write you this. You need to take it, Mr. Hill." It was like, you know, no, no other pain medicine. You need this one. And it was very stern. And it was very like my grandpa even
You
looked
were
at me like,
there?
yeah, I had to drive him home. And they were even looking at like he even looked at me and was like, I'm not going to take this. I don't even want it. And he never filled it. He made it through okay. He went through a lot of pain for a long
So
time when he didn't
here's
need
my
to,
thing.
but
So I agree that doctors shouldn't be getting kickbacks for writing particular drugs. Um, but my thing is with
It's not overt kickbacks though. Keep that in mind. It's like they get speaking opportunities, and so they get brought out to a convention and they get paid $100,000 because. But the only way you can make it to the convention is if there's it's all in dope sick. There's been many documentaries, many podcasts with whistleblowers talking about this. Like
mhm.
it's nationwide. It's only in our country. It's horrific.
You should watch
Again,
Dope
it's
Sick.
also
It's really good.
yeah.
Uh, like,
It's
no
also with
matter what you
surgeries.
think.
It's not. There's no like with your grandpa with the shoulder, right? I guarantee you they wouldn't have pushed like stem cells in rehab first to see what would happen. They're just going to go
Mhm.
straight to the surgery because the hospital gets paid more off of it. Like it's that kind of that level of deceit that is nationwide.
yeah, but why do you immediately assume it's deceit? That's my thing. Is like in order to assume intent, I need extra proof.
Well,
Like
in my grandpa's
whoa,
situation, real quick,
y'all have
just
been
for
yapping.
clarity,
I need to talk.
I don't think my
Motherfucker.
grandpa's
Oh my
situation was
god.
that, is all I'm saying.
Okay. All right. Yeah, I just want to get some stuff out there. So, like I said, my dad's my dad's a doctor. I've known a few doctors. The friend, Tessa's friend that we went out and visited in Palm Springs is a pediatrician. And we talked a little bit about this sort of thing before we even had the conversation we did. Um, and she told, it kind of is relevant. She told us a story about, because she's a pediatrician, so she handles kids. She was telling us about how there was this kid who comes in who's like grossly overweight. And she keeps trying to get the parents to get them on like a better diet, get them exercising. The parents, lazy, won't feed them anything else. And they're just like, oh, just give her Ozempic, just give her Ozempic, just give her Ozempic. And they've come in several times. And eventually she's like, okay, well, if you're not going to do anything else, I'm going to give the kid Ozempic. Right. Other situations where obviously.
And the parents asked for that?
Yeah. She said the parents were specifically asking for Ozempic and would not listen to anything else she said.
For sure.
So then it's also incumbent on that doctor to then also talk about the peptides they have to take and the strength training, because if you don't, it weakens the heart, and there's all kinds of Ozempic is fucking people up if they don't follow the proper protocol that you got. So like bodybuilders have been doing shit like Ozempic for years, right? And so they know how to use it and they know what the side effects are. They know how to counteract them. So this stuff's been around for a long time. But these doctors, they don't prescribe the other side of it because they don't do their homework. They just go with whatever the big pharma rep comes and says. That's what they go with. That's their god, and that's what they go for. And it's wrong. And they've been burned over and over and over again. They know that they're pushing poison on people, and they keep doing it because everything. It's on like a conveyor belt. So it's like your cattle, and they just shuffle in as many people as they possibly can because everything's ran like a Medicaid or Medicare facility now. So like I guarantee you, she just did Ozempic and nothing else. And we know the side effects of doing that, and they do it anyway. And now they're doing it to kids. It's horrific.
I mean, yeah, obviously, I think that's just good medical practice. If you're going to prescribe something, obviously, you should tell people the side effects and stuff. I mean, I don't know what level of responsibility that normally is on the pharmacist versus the doctor, but and then she talks about like all these kids she has to deal with where they're in California and they have this like. I don't know what she called it, but it was like a homeschooling program basically where like a bunch of these kids who do homeschool and like have no social interaction are like depressed, and the parents want to get them medication because they're depressed. And it's like, well, obviously they just don't fucking socialize or go outside. So of course they're like depressed. And she tries to get the kids to go out and socialize. Now, this is obviously a different situation because you're dealing with kids and the parents are, to varying degrees, messing stuff up, and they're asking for drugs for their kids because they're, in several of these cases, probably messing up the kids. Yeah. But that's sort of a segue into a lot of times people will go to the doctor having Googled something on fucking WebMD and said, look, I have ADHD. I need 20 milligram Vyvanse. And the doctor's like, well, maybe you don't have ADD and you don't need Vyvanse. Maybe you just need to, get your sleep schedule right and do a little bit of exercise and blah, blah, blah. And they're like, no.
Where are those doctors at? I've never experienced that in my life. And I've been to so many doctors. Not one time.
I agree. As somebody that does,
when I went to a psychologist as a kid, so they tried not to, and I don't know. I got diagnosed ADD, and I can't remember exactly, but they didn't want to give me drugs, and I was like insisting. I was like, yeah, my grades are suffering, whatever, I need it. First thing they gave me was Strattera, which is non-stimulant medicine, and then eventually after that didn't work for like 2 months. Then we moved over to Vyvanse, which then eventually I stopped taking because I didn't like it because it made me not want to eat and I was losing a bunch of weight. But I mean, it depends on the person. Like, I feel like the vast majority, and same thing with the pediatrician friend who I know, said she was trying not to give him medication. But I think the big problem is we have this bad feedback loop where a bunch of people will come in, they'll talk to the doctor, they'll expect drugs, they don't get the drugs, and then either they leave and go to a different doctor, or the doctor will try to tell them, hey, you need to do this, try, but improving your diet, blah, 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 for a month or two. The person goes home, eats, doesn't eat McDonald's, maybe once a week, and they make a home cooked meal, and their, I don't know, their cholesterol or whatever it is doesn't get any better. And then so the doctor gives them drugs because the person can't take care of themselves. And then you rinse and repeat that 90% of your patients, and eventually you're just going to skip the middleman and say, listen, take this thing, try to get your diet in order, and eventually maybe we can drop you off the meds. But the people will take the pill. It's the easier option. It fixes their cholesterol temporarily, and they never fix their diet because the
Well,
pill worked. And then
hold
they
on.
become a
So
fat fuck and they have a heart attack and die,
the
or
the
whatever
the
it is.
fact that you're even bringing up cholesterol tells me you don't. I mean, like cholesterol.
I don't know
Have you
anything about
followed us?
medicine. I was just giving an example.
Well, I'm just saying, like this is an example of what I'm talking about. So cholesterol has been deemed problematic for your heart, right? And so then they like, okay, you need a statin to lower your cholesterol because this is what causes heart attacks, right? Well, if you go look at the data, they started cholesterol in super healthy people, even like in other parts of the world that don't even use statins, like in certain parts of Asia, their cholesterol is like 300 plus. It's super high because you know why? Your brain feeds off that. You need cholesterol. It's like a delivery system. So when you start lowering your cholesterol, that's what causes dementia. So if you start following statins when they came on the market, the total LDL and the high numbers of that, they wanted it to get lower because statins make it lower, right? And so there's a parallel where the more statins went on the market, the lower they kept the heart association keeps saying this is where you need to have your cholesterol. It's all bullshit, dude. Like everything is a lie. It makes me. I don't
But
even like
that's my
talking about this
problem.
shit.
Is you just
It's
assume everything's a
infuriating.
lie. Like,
It
why
is.
can't people fuck
I
up?
can keep.
Like,
I can keep going. There's so many examples.
Well,
There's
let's
so many
stick. Wait,
examples,
wait,
dude.
wait. Let's
because
stick to
here's
the scripts here though, because I do want to talk about everything that Dylan said. Like, shout out to your pediatrician friend, and shout out to your dad too. That you are talking, but you're talking about two doctors, and I'm presenting you with probably 5 or 6 in my
Generalization.
examples,
well,
and he's presenting you with probably 10 in his situations between him and his wife.
but if you
And
go to the doctor looking for drugs, then you're going to end up probably getting drugs. That's
that's
my
a
Right.
thing is like
problem
when
though,
you were
Dylan.
looking for
You
drugs,
need to be able
that's
to
what you were
turn.
looking
Well,
for.
that's what
So
I'm
why
trying
are
to
you
get to
surprised
though.
that that's what you ended up getting?
That's what I'm trying to get to though, is you have to turn them away. You have to say, no, I'm not doing that here. That's not who I am. I'm not your drug dealer. I told you the way to get better. In a lot of situations, I'm not against uh pharmaceuticals. I'm not against all drugs. He's probably more anti-drug than I am. But I do feel like if I gave you the blueprint and you're not even going to try it, I'll turn you away from my practice. Like I'm
So
not your drug dealer.
say you're a therapist, right? You have somebody come in, they say, "Hey, I'm suicidal, I'm depressed. Um, I need help. I need Zoloft or whatever antidepressant," right?
Yeah.
Psychologist says, "Hey, I don't like giving out antidepressants. Here's what you should do. You got to go outside. You got to lift some weights. You got to blah 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 blah
Yep.
blah. Make some friends. Talk to some people. Talk to your family. Socialize." Guy goes home, doesn't go outside for a week, kills himself. Family sues the therapist for malpractice because they didn't give him drugs.
Is that possible? Can you
If
sue me
I'm
because your
sure.
child killed himself?
I
You
would
can
argue more
try.
I
people
would have
kill
to double
themselves
check.
while being on
Or the example
SSRIs.
we
I
gave.
gave him, and well, wait a minute. I gave him a prescription,
Well,
and he didn't follow my prescription. I mean, I'm sorry.
well or the
And
example I
that's not
talked
the
about
best
where
example because you're talking about depression, which is like you can think what you want about depression. I do think that exercise, sunlight, I think you do too, Dylan. I think all of those things do help with depression, but I think depression stems from a deeper root that needs to be resolved. It's not as quite as simplistic as just like a prescription, right? So that is a little bit of a different situation. Whereas like I'm just talking about uh, less therapy, like therapists, the way you guys think about chiropractors is kind of the way I think about therapists in a lot of ways.
Agreed. It's the
But
same thing.
because
no
they take
way.
it, advantage. But I think that they're like it's different with them. It's not based off of drugs. It's just based off of getting you to come back. I do think that
Okay.
therapists are money
Let's go to
hungry.
the example of blood pressure, right? Someone comes in with high blood pressure. Guy says the same thing: go exercise, go touch grass, whatever,
But
and we'll hold off on prescribing you medicine for blood pressure, and then they have
we're
a heart attack.
talking I'm talking more so about mood altering substances. So Silver, if you want to attack the blood pressure medication part, you can. I'm talking more so just about mood altering substances that literally F your life up forever, like opiates,
Because here's
amphetamines.
the thing: is I'm trying to think of like doctor content I've watched. I've watched several Dr. Mike Jubilee things where he talks about this. Like he says, medication is temporary. It's like a crutch. where you go in with high blood pressure, you get your crutch, which is your blood pressure medicine, and
Right.
then in addition to that, you work on fixing yourself, right?
For sure.
That's a
And then
good doctor.
eventually
That's
the
a
goal
good
is,
doctor. That's not normal.
That's a
yeah,
good
but
doctor, yeah.
and I get a lot of people are forced to do certain doctors, but that's a bad doctor. Or like the thing is, people need to take some level of responsibility. It's the same thing with lobbying. It's the same thing with a lot of politics where people are not like you're basically giving up your power to your doctor, to your politicians. I can't think of other examples now, but
No, I agree.
I have huge
Accountability
problems
is
with this where
important.
like
It's the most important.
people want to say ban lobbying or ban these certain practices in medicine. And I think there are a certain level of practices in medicine that we should ban, but people also need to be able to take responsibility and like try to find a different doctor if you can,
Yeah.
Oh,
No,
or
you're
talk to your
right.
we're
doctor and say,
community.
listen, I don't want medicine, what other options do I have? Because oftentimes as a doctor, like unfortunately with our system, doctors are there's a huge pressure on doctors to turn over patients constantly, right? They're
That's
a
what I was
hugely
talking about. Yeah, the
expensive
cattle.
liability for hospitals. So they want to see as many patients as possible, or they're driven to see many patients as possible. The pediatrician that I was talking about said they literally had quotas at certain hospitals. And if they didn't meet the
Yeah.
quotas, they ended up having to like pay fees or something, which is crazy.
Right.
So of course they're going to go to like the lowest common denominator solution of, hey, here's a pill, this will solve your problem. But
That's
the
part of
people
the
need to also
problem.
do their due diligence and see what their other
They
solutions are or
they
what can
do.
help them long term.
But Dylan, when we're talking about these
It
mood
didn't used to be this
altering
way.
addictive substances, though, these people they really don't have the ability to just like they get hooked as soon as they get the drug. So at that point, I'm just talking about like Schedule 1
But
narcotics at
what
this
I'm
point.
saying, what I'm
But
saying
I
is,
agree.
Silver seems inclined to say these people are lying, they're bad, they're greedy, whatever. I'm saying is a lot of times they're
No, I'm
probably
talking about the
not that.
system. I'm saying the
Okay, well,
system is.
so
Because it's not necessarily
that's
their fault. Like you ask your dad, you can text your dad right now and say how much time when you were in school did you spend on nutrition? He's going to say like one chapter out of the entire fucking 8 years or 12 years, whatever it was.
well,
So
he's a
like
DO, so he was different, but
whatever. So the point is like they don't focus on rehabilitation properly. They don't focus on the body properly. They don't focus on nutrition. But case in point, when my dad had a heart attack due to stress, when the surgeon he went to, thank God, happened to be the number one guy in Dallas. He's amazing. But in the aftermath, we were talking to him about how to have preventative maintenance and stuff like that with my dad. This motherfucker said straight up, and I bullshit you not. He goes, I need you to start focusing more on plants and not protein because it's not essential to the body. I looked right at that dude. I said, "You're a stupid motherfucker." And I said, "We're not gonna, Dad. We're done here." Like that's the dumbest shit I've ever heard in my entire life. And this is the top dude, so he's like the dude for saving people's lives. And he is the dude. He's awesome at it. So I'm not taking that away from him. But when you come
he's
back
a
and say,
surgeon, right?
"Yeah, right," so, but why the
So he's a
fuck
top
would you tell
surgeon, so
somebody?
he's not a top nutritionist. Yeah.
No. Right. That's my point. Is why would you come back in the office and say you need
Right.
to focus on plants and not protein because you don't. Your body doesn't need it. That's completely false. And so, like, you're going to make it worse for him. That's crazy. How many people listened to him after the surgeries and then they had complications because they didn't focus on protein? So my mom listened to him and not me. And guess what happened? His health started declining. So they started adding me back in, and guess what happened? Everything went through the roof. And he was, and so his checkups after the 6th month or whatever it was, they were like, "Man, he's really turning around. This is doing great. What's your diet like?" My dad's like, "What? Fuck you. I started barbecuing again." Like it just drives me fucking insane. Like there's nothing you can say that will ever change my mind because I've seen so much bad shit in my life with doctors. Now I grant that's not their fault. It's the system that pushes on them. It's making them see all the customers like you were saying, like on a conveyor belt. But there has been doctors that broke away from the system, like where I go, ways to well, which is what Rogan promotes, where they get away from the hospitals, they get away from insurance, they don't take insurance, and so that way they can actually focus on you, the patient, and do what's right for you, and do full blood panels, and go get your CAT scans, and they do preventative maintenance. That shit doesn't happen on a wide scale. It could,
I
it
love
used to
it.
be that way, but it's gone because everything is crony capitalism now because everybody's getting a fucking paycheck. It's insane, dude. It's
Which
absolutely insane.
doctors should be able to get paid a lot of money, I think. But I just think that you have to, like, in the way that you're talking about the people holding themselves accountable, Dylan, I think that the doctors also need to hold themselves accountable too and just say, like, no, this isn't what I'm doing. This isn't the route I want to take. This is going to ultimately lead them into addiction. And that's my fight, is the addiction fight. So this is going to ultimately lead them into addiction. Whereas like a blood pressure pill might could really save your life. You know what I mean? If you're just down and out and you can't figure it out and you can't get there because that's hereditary,
So
it's genetics, you
what do
can't
you
do anything
do?
about it.
Like, say someone has some crazy invasive surgery, right? They just had a hip replacement. They're 60 years
Hmm.
old. They have low pain tolerance. Like, what do you do if you're a doctor? Like, you just say, "Oh, fuck you. You're going to be in
Well, it's
excruciating pain. You're
protocols.
not going to sleep for 2 weeks."
No, it's protocols where you have a built-in protocol where you wean people off the
Therapy.
right way.
Well, my grandpa did just
Well,
get
yeah,
hip surgery. My grandpa just got hip replacement surgery a few years ago as well. Shoulder, hip, knee, all three from 65 to 75 years old. And when he had that hip replacement surgery, um, they prescribed him something called tramadol, which it's not an opiate. You know what I mean? It's still kind of a pain pill. But that the therapy center that he went to, not the doctor, but the therapy center that he went to for
tramadol is an opioid.
no way.
I just googled it. It says it's an opioid.
Oh well.
It's a
Either way,
derivative of,
It's
I
an
believe.
opioid
well,
analgesic or
listen.
whatever
When
that
when
means.
he went to physical therapy, he gave it his all, and he was able to heal relatively quickly because the surgeon was really good and the surgery went really great. But as he was going through the physical therapy, they told him, not the doctor, but they told him, you should try to not take those pills. You know what I mean? And that's even worse, honestly, because that doctor told him this isn't an opiate and he told him that it's a non-addictive substance. But either way, eh, I
Well,
was there with
here's
him
the
through
thing is
all of that.
I don't think doctors are infallible. Obviously, I don't think any
Of
medical
course.
personnel is infallible, right? And
Nobody
I think
is.
the thing
Yeah.
where I think it's funny when people find a doctor that agrees with them and they're like, see, this person's a doctor, they agree with me, right? Like, I hate that shit, on the other side. But the thing is, I think everyone's driven to saying like, oh, the system's corrupt, doctors, they're just bought and paid for, and they're getting paid to fuck you over, right?
Hmm.
Where the funny thing is doctors and insurance companies are on polar opposite sides of the incentive spectrum, right? Insurance companies want you to never use your insurance or use it as little as possible, right?
Oh, they're worse. Yeah.
Doctors want you to use insurance to get treatment and stuff like that, right? So if doctors are prescribing you a shitload of pills that your insurance has to pay for, are they not on opposite sides of the incentive spectrum?
I think it probably depends on the
Sort of.
pill. Because whereas like, yeah, the insurance might have to pay for it, but they're gonna ultimately get kickbacks from the manufacturers of these drugs as well. Right?
The insurance companies? I don't
Yeah.
know if they get kickbacks from pharmaceutical companies.
We should look that up. Since you
I
got
don't know.
Google
I
Docs
just
in front of you.
know
I don't know that to be true, but I would assume so. Like, if you're gonna have to pay for these pills, and we're out here pushing these pills, and everybody's willing to play ball except for the insurance companies, I'm sure that they're giving the insurance companies some kind of
it.
kickback.
It's also a societal problem too, because we are, as a whole, we are lazy and want the easiest options, like Ozempic. That's why it blows up.
That is
People
true.
don't want to do. They don't want to do the work. So we're not going to go out and so it's instead of protesting in fucking Minnesota, we should be protesting against the insurance companies and the system of healthcare. But that's never going to happen. So I mean, yeah, a lot of the onus is on us as well. But there on the
That's
flip
what I'm
side,
saying is I think
you're
sorry, yeah, I
starting to
think
see
most
it.
of the responsibility is on us.
Wait, right, but I think you're starting to see because of podcasts and because of people like say what you want, but Rogan's really changed the game with this because he put Waste the Well on blast, and now they're huge and they're growing, and the stuff they're
Is
doing is
this
saving
one of those
lives.
places that just prescribes fucking ivermectin for everything?
That
Literally, not
was kind of
literally the
funny.
opposite.
That was a good one.
Okay, good.
They for
That
first and
was pretty
foremost do
good.
blood work, just straight blood panels. So like they that way they see what you're lacking, what you're deficient in, and
And they
they can
build you
even
from
help you
there.
with they can do workout programs. They do. There's a whole bunch of things they do. Ways of Well is amazing, and you're starting to see a bunch of things like that pop up. And then you have like the carnivore doctor, Dr. Baker, right? You can disagree with his lifestyle and everything you want, but he was an orthopedic surgeon. And then the way the hospitals get pushing for surgery, he's like, no, you can fix it by inflammation, get rid of inflammation. You can use BP157 as a peptide to like heal yourself 50% faster, which is what Aaron Rodgers used whenever he tore his Achilles. Like there's lots of things out there. Then the government fucking bans it. Oh, BP157 is now illegal. Why? Because it fucking works and you don't have to take a bunch of medicine. So like this is go. It's a it's a systemic issue, but it also bleeds into the community or the citizens, and we need to stand up and start demanding more from
I
our
mean,
government, which is what we did with RFK, and he started doing some of it. So that I mean, that's the people speaking up, saying, "Hey, we
And now
want
measles
change
is
in our
on the
healthcare."
rise.
well,
That's also
also,
bullshit. But keep going.
Well,
I go ahead.
I mean, I think that's crazy. What do we? I mean, I can look up measles cases right now. The amount of cases is like spiked
So you're gonna tie
drastically.
that to people not getting their kids vaccinated. Or you're gonna tie it to the illegal immigrants coming over the border that don't have any shots whatsoever.
Mm.
How you
We can
differentiate?
check. I mean, they didn't spike under Biden, and I
There's
thought
no
that's when
data
all
for
the
that.
illegal immigrants came through. So
There's
we
zero
don't
data
need
for
to
that.
talk about it. Okay,
Just
I'll do
like
more
just like
double
when
checking on that.
That was a good
they weren't
question,
even
though,
mandating the
Sylvan.
COVID vaccine when they're coming across the border then during 2020, like 2022. They weren't even doing that, but they're
Well,
trying to mandate it on schools. Like, no, don't even start that fucking
what
game.
I would like to do, what I would like to do here is I would like to say that I think that all three of us are in agreement that people need to be accountable. But I also think that the people in charge need to hold themselves accountable as well.